I'm going to press record. For people who can't make it to the live version here, thanks for being here, everybody. I've got, what do we got here? Carolyn, Charles and Rebecca, Dawn, Patty, Robert. We're talking about BPH. Fun stuff, huh? So before we get started, I like to let a few ground rules here. This is not diagnostic. This is not a treatment plan. Any conditions, concerns, things like that, you definitely need to see your doctor about for individualized care for informational purposes only. It is recorded again, so people who can't be on the live version are able to access this information at their convenience. And I just about downright beg for participation. The whole point in doing community outreach is to connect with the community. So I have a lot of information, but this 30 to 45 minutes isn't meant to be a lecture. It's more to be, hey, what does the community want to know? What are their questions? How can we help support? What do you have going on? So that's really the goal of us doing some outreach to the community. So BPH, benign prostatic hyperplasia, formerly known as hypertrophy. Big prostate. The first question I get a lot of the time actually from people who come in with BPH is, what is my prostate even doing there and why is it bigger? So kind of address that one first. The prostate is supposed to be about the size of a walnut. It's located just in front of your rectum, between your bladder and your penis, and it's responsible for secreting fluid into the seminal vesicles as you ejaculate to help protect the sperm. So that's its function. That's where it is. Why does it get bigger? I mean, that's still, we have a lot of theories, we have a lot of questions, we have a lot of treatments, but the number one thing that we know is as we get older, the prostate enlarges. I think the first thing to keep note of is that there are different zones of the prostate. We've got a central zone, a peripheral zone, and a transitional zone. BPH, the hyperplasia, the big part of this that happens is only in the transition zone. That's that central area right around the vesicle. I have a picture here, but it's black and white, so it's not real helpful, but you can Google it, the zones. And it's important to recognize that because cancer happens in the other zones, prostate cancer. So when you have a digital rectal exam or you have imaging done, they are actually looking at the different areas or regions of your prostate to see where the enlargement happens. So that's what we know. We know that the hyperplasia comes in that transition zone right in the middle of the gland. There's two types of BPH and technically three because the third one is a mix of the two. The first one is spasmodic or stromal. And that is the most common individual type. So the most common type is a mix of the two. But the symptoms that we see more often is kind of irritative symptoms, waking up in the middle of the night, frequency, urgency, kind of that spasming, overactive bladder type of situation that we have. That is the smooth muscles in the bladder and the urethra cramp, and they make the impingement and they kind of constrict our ability to urinate because of that cramping or that spasmodic action that they're going through. Epithelial or hormonal BPH happens when the tissue, it just keeps enlarging significantly and it gets bigger and bigger, and that's when we start to see that prostate size bigger than 50 cc. So if you ever had your prostate enlarged or imaged and they tell you how big it is, if it's over 50 cc, then we typically say you have a little bit more of a hormonal or epithelial cause for that. And those symptoms that predominantly come along are the weak stream, hesitancy or dribbling, so that's a difficulty initiating a stream, or when you think you're down, we get a couple drops afterwards, or that incomplete emptying. The most common type of BPH is a mix of the two, and that's what most of my patients come in saying, yes, I have all of the above, and it's probably a mix between the two. So that's the most common presentation that I see of BPH. So with that introduction of what the prostate is and where it is and how it presents, does anybody have any questions? And I think you're talking up here, Robert, but you got to unmute yourself.
Can you hear me now?
Mm-hmm.
Okay, good. So my issues in the recent past have been periodic. It seems like there was something that was initiating a sensitivity, and then my prostate would cramp up, and then I'd have problems with urination, and it would last through the night and then kind of go away the next day, and then I'd be fine again for a period of time. And so I recently got off espresso.
Mm-hmm.
I was drinking, not every day, but a couple times a week, espresso, and I was starting to associate my episodes with espresso, and so I stopped that a couple weeks ago, and I seem to be better. I haven't had an episode since. What can initiate or cause or trigger these symptoms?
Yeah, so I mean, the very first thing that I was going to say, when you tell me it's variable or it comes and goes or waxes and wanes, the very first umbrella thing that I would think of if you were my patient was a food sensitivity. So the fact that espresso or caffeine, which is a very known trigger for BPH, was something that's affecting your severity, kind of falls under that umbrella. And everybody's going to be individual. Everybody has their own set of food sensitivities or what their immune system is more sensitive to. It's not a true allergy, but it's a sensitivity that causes your immune system to react and then increases inflammation in the body. Espresso is, or caffeine is, one of those ones that kind of is. Anybody who comes in that has, I say, hey, let's try to cut back on this. Alcohol is another one. I typically think of all the foods that aggravate GERD as being kind of the top tier foods that I reduce for BPH as well. So interesting enough, it's espresso, or I'm sorry, caffeine. You kept saying espresso, so I got that in my brain. Caffeine, chocolate, alcohol, the nightshade family can be really triggering for people's immune system and have that smooth muscle spasticity. Because if you think of it, a lot of times acid reflux is the lower esophageal sphincter acting up, and those foods that trigger that. And we're talking about smooth muscle spasticity. And so when we kind of eliminate or slow down those foods and check into sensitivities, those tend to be our top culprits there. So I'm glad that you found that on your own, and that's something worth looking into. And then if espresso is something, I'm definitely one of those naturopaths that doesn't take everything away from you, but finding balance and moderation. If this is something I don't want to do without, then how can we actually help improve your hydration status? And then how can we partner, right? I'd rather add foods in unless it's really detrimental or you're having a huge response to it. How do we add foods in that balance out that inflammatory action of espresso, and then bring that down into a moderate level where maybe you're not having so much that it would trigger symptoms?
Now, when you say nightshade, so you're talking about tomatoes.
Mm-hmm.
And is that primarily raw tomatoes out of the garden, or it's my understanding that some of the irritants in tomatoes can be eliminated through cooking?
It can be. I don't actually get that down in the weeds with it to start with. I usually will say, because tomato sauce can cause it. And I kind of go right off the bat, if we're going to eliminate some triggering foods, tomatoes, eggplant, peppers, kind of everything in that nightshade family, let's try to remove it as a trial. So, and then again, if somebody individually comes in and says, oh my gosh, I can't live without my cooked down tomatoes. Okay, let's remove some of the other things, and this is the thing you can have. So it's dose and frequency dependent most of the time when it comes to food sensitivities. If it's something that's chronic, there is benefit to long-term elimination and then slow re-challenge to let the gut heal and let your immune system settle down a little bit so we can lower the inflammatory burden. There's definitely a strategy behind food-related sensitivities for symptoms like this. And again, if you've noticed, hey, espresso is my big trigger, and you take that away and all of your symptoms resolve, then it's, being creative with how do you manage life without espresso, or how do you manage your BPH if you have the espresso?
Yeah.
No, thanks for sharing. I appreciate that. Yeah. Anybody else have anything to add or questions to ask? Okay. So why are we talking about it here? The very first thing is people, I like to say every single time I do outreach here, is that the natural medicine industry is not regulated by anybody. And that could be a blessing and a curse at the same time, right? We don't always want somebody regulating everything we do, but it's also nice to have a standard. When you're doing your own research or your own ideas on how to treat BPH or any other health condition you have, if you turn to natural medicines, then I do recommend finding a licensed naturopathic doctor to help you with that. Natural medicines are just as important to have quality product and dosing and frequency and medicine hygiene as it is for pharmaceuticals. Some natural medicines are blood thinners. Some natural medicines inhibit liver enzymes. Some natural medicines don't work well with other pharmaceuticals or other natural medicines. So they aren't all benign. And if they are, and they're indicated for a certain situation, like let's bring up saw palmetto because it's one of the most well-known natural medicines for BPH, it is dose dependent and it is quality product dependent. So it's kind of an aside. I bring it up every time because anybody who steps into my office with 30 plus supplements, I say, I don't even know if these are quality products, if you're getting what's on the label, and it's definitely not up to dose. And what you do when you overwhelm your system, even with natural medicines, is it's more for your liver and your kidney to process. So they can provide some detriment as well to the body, especially when we're talking about inflammation burden and what we have to do with comorbid situations. So I come on very strong about that because I'm very passionate about the abuse of and the lack of regulation for natural medicines and how important we need to handle those and how responsible we need to be there. So when it comes to severity of BPH, there is an objective measurement, and it's called an IPSS questionnaire. And if any of you have been to the urologist, you probably had to fill one out, or I hope you would have anyway. And it's like every 3 months, that's the smallest interval that I would ever give the IPSS questionnaire for. And that shows how much it's affecting your quality of life, your urinary symptoms. Because of that, it's really, really helpful for us to see if certain treatments are working well, whether they're natural or pharmaceutical. A digital rectal exam can be really useful if the prostate's really big. I mean, we can feel it, but again, if I don't see a patient 6 months in between, my ability to remember what their prostate felt like 6 months ago, I mean, it's not as familiar as the end of my own nose, right? So it's definitely not as objective as we'd like it to be. So the IPSS definitely puts the ball back in the patient's court to say, how are you feeling? Have your symptoms gotten any better? Is this affecting your quality of life more? What is the severity in your terms? So I can use my objective measurement as well as your interpretation of what's going on as a measurement of success of treatment. You can also do the post-void residual is a really important test to look at as well. And that's essentially an abdominal ultrasound that shows after you eliminate and you go to the bathroom, what's left in your bladder. If you're having residual in your bladder, if you're at risk for a UTI, and how we can make sure that that value also improves. So if you're working with a urologist and a naturopathic doctor or just a urologist, these are some different things that I would request testing on to show either improvement or changing of your current treatment plan, because those also show severity of the condition. And then you can also get what's called a uroflowmetry, which shows the force of urine with which you're going. So if it's coming out slowly, or if you have a strong stream or a weak stream, they can also objectively measure that as well. So those are some different ways to measure how things are progressing in the body. What we do know about PBH is it's actually happening. It happens in all men all the time. Like I said, as we age, your prostate grows, like your earlobes and your nose, things like that continue to grow. But it is happening at a higher rate in the Western world versus the Eastern countries like China. A big theory behind this is actually the xenoestrogen level with which we're inundated with in our environment. So plasticizers, xenoestrogens, there's a lot out there that act like estrogen in our body and can actually facilitate the growth of the prostate gland. Ways to combat that is actually with phytoestrogens, and those come in plants. So flax meal, legumes, and different products like that can actually combat the effects of xenoestrogens, things that we're picking up from the environment. Has anybody used any of those treatments or have heard of that kind of therapy using soy products or plant estrogens as a way to combat BPH. Okay, so that's one of the biggest questions that, again, hey, dietarily, how can I help support that? In a plant-based diet, it doesn't necessarily have to be completely vegetarian or vegan, but increasing the amount of plants that you eat is definitely shown to help, and then increasing the amount of phytoestrogen rich foods is also something that we want to focus on as a treatment. Detoxification, and avoiding those xenoestrogens, right? So plastics and different places that we pick that up. A really great website to learn about xenoestrogens is actually ewgenvironmentalworkinggroup.org. They have a lot of information about environmental toxins. You don't have to go completely down the rabbit hole as far as, oh my gosh, everything in the world is scary, but really limiting that search to, hey, where do I get xenoestrogens? How do I pick those up, and how can I avoid them? Is a really great resource for you. Regular exercise is really a phenomenal way to help slow the progression of BPH. So estrogen, excess estrogen, which we all have, male or female, is stored in adipose tissue. So when we detoxify the body and we lower that accumulation of adipose tissue, we actually lower that estrogen burden as well. That can contribute to BPH. Any questions from here? Still doing okay? Okay.
What's adipose tissue?
Adipose tissue is fat. It's a very nice medical way of saying fat. But those cells, adipose cells, I mean, it's not just that we all have adipose cells in our body, but the accumulation of them, adipose tissue holds all toxins. So I guess I shouldn't say just estrogen, right? If we have a toxic burden, heavy metals, different things like that, adipose is a really great place to store all of that. So I guess I'll follow that up with, I'm glad you asked the question, because if you try to go on a detoxification protocol on your own, I would highly recommend against it. We have 5 organs of elimination in our body, and that's our lungs, our skin, our liver, our kidneys, and our bowels. If any one of those aren't functioning properly and you try to do detoxification, you can actually cause a lot of harm, because essentially what you're doing is you're pulling those toxins out of the bones and the fat and these storage sites that our body uses to sequester them. We're pulling them back out into the blood to be filtered through to eliminate. And if we can't eliminate, if there's a stopping point there, then those stay in our blood and they can cause toxemia and symptoms of that. So detoxification is definitely something that's being thrown around in the naturopathic field a lot. And people are kind of all willy-nilly, I'm going to go detox and I'm going to go do this and I'm going to do a fast and I'm going to do hot sweating and saunas. But if you're chronically constipated, or you have kidney disease, or you're hyperventilating all the time, like so many of us aren't doing deep breathing exercises, then you can actually cause a lot more harm than good, because our body's smart. It's a brilliant engineered form that we all live in, and we sequester those toxins for a reason. Do we want them out? Yes, but we want to get them out responsibly so our body can actually handle that process. Some red flag symptoms of BPH, things that please don't walk into my office for, is if you go to pee and you can't. If you have what's called acute urine retention, then you need to go to the emergency room. That's an emergency. If you try to pee and you can't pee, that actually can be life-threatening. There's a lot of toxic in your bladder. If before you get to the emergency room or the paramedics get there, the very first thing you need is get in a hot bath. Get in there, try to relax all the smooth muscles so you can just pee into the bathtub and release that urine. But that is an emergent situation. Again, don't walk into my office if you're like, I can't pee. Then that's the first place I'm going to send you, is to get catheterized. Bladder stones are also a cause for some of these symptoms. And if we determine, hey, it's probably not BPH, everything else looks fine, they can also cause chronic retention and difficulty in spasming. So that would be something that we would work closely with the urologist about. And then there is some incontinence. There is some other conditions that cause what we called LUTS, lower urinary tract symptoms. So it's really important to know that just because you have lower urinary tract symptoms does not necessarily mean you have BPH. So there's a lot of different things that can contribute to those, and making sure that somebody is diving in and not giving you this really convenient diagnosis that just because it's common doesn't mean it's true for you. Making sure that that is the cause of your urinary tract symptoms. I do have a patient who is under so much stress that he says, I just don't have time to go to the bathroom. So I don't think that there's anything else wrong physiologically or anatomically other than the stress level being so high, it's actually impairing his nervous system's ability to release urine. So like I said, it's very common diagnosis of BPH. It's very frequent that it happens. It doesn't always mean that that's the reason for urinary spasticity, overactive bladder, different things like that still exist, right? Where do you guys want to go from here? What else do you want to know?
Been great so far. Thank you.
Oh, of course. Anybody else have any questions? Anything else that you want to know about BPH?
Do you know the Stephen Gundry book, Longevity Paradox?
I don't. I feel like it's ringing a bell because I get book recommendations all the time from patients, but I haven't read it.
Yeah, he's written a bunch of books, but anyway, that book reflects a lot of the things that you're saying in terms of just a healthier diet, more of a plant-based diet, staying away from nightshade, other things like that. There, foods and elements in foods that cause an inflammatory response. And so I hear you reflecting a lot of the things that he said in that book. So that just kind of reinforces.
Yeah, and there's another one out there you just brought to my attention. So this is for prostate cancer specifically, but it's a really great read. If anybody has comorbid, prostate cancer and BPH, a lot of times people will have both. So I want to recommend this. It's called Invasion of the Prostate Snatchers. So this is another great read on, hey, what is, prostate cancer, and how are we evaluating that, and how quick are we to remove, the prostate when maybe we might not need to. Not to say that it's not necessary sometimes. I definitely believe that, and I practice integrative medicine, and I love my surgeries that save lives, but definitely staying well informed of what's happening in your body and why it's there. I mean, the term hyperplasia, even to zoom out even further, it brings up a really good point. I mean, hyperplasia in general, right? Why are we hyperplasiaing? Why are things growing? Why are our cells dividing and becoming bigger? And it typically is the body's response. Again, the body is brilliant to inflammation, to injury, to perceived injury. If the body thinks it needs to protect itself and create a wall, it's going to do that at a higher rate with these insults to it. So when we take these naturopathic approaches and these natural modes to healing, what we're doing is really removing insults to the body instead of putting, a Band-Aid on it to say, well, we're just going to somehow intercept that biochemical pathway so it can't do it, which is really effective. And we'll talk about treatments for BPH and their efficacy and what we recommend and how to go about that. And also, that's not the only solution. And that's the type of medicine that we practice here at Coeur d'Alene Healing Arts. Like, yes, here is a treatment for what's happening to improve symptoms, to help your quality of life, to slow the progression down. And also, let's swim upstream a little bit, or I like to say, let's zoom out to 20,000 feet and see, why is it happening in the first place? This is a natural progression, but why in you is it happening faster? And how can we eliminate some of those insults? So it's kind of a twofold process all the time. And twofold is a huge underestimation, right? It's a millionfold. Each of us have our own constellation of things that we're vulnerable to in there. I want to point out too, that metabolic imbalance, type 2 diabetes, any metabolic, imbalance, I guess is the word I'm looking for. syndrome. Metabolic syndrome is the diagnosis for that. That can also contribute to BPH, right? Because that's going to be a blood flow. We're talking about perfusion. We're talking about nerve health. So those can also contribute to the health of all of our end organs. So when we talk about type 2 diabetes, let's just focus there. Hyperglycemia, the two organs we focus most on is our eyes and our kidneys. That's where it shows up first. That's where it's easiest for the optometrist to say, oh yeah, you're having blurry vision, you're having some retinopathy, it's from your elevated blood sugar. And on a blood test, it's really easy to see kidney dysfunction as a result of type 2 diabetes. It's a lot less easy to see everything else that's affected by it. But like I tell all my patients when they walk in, think of those itty bitty little capillary beds where nutrient and oxygen exchange happen, right? All that blood has to get through those big arteries, all through the tiny ones, and then all the way to the capillary bed to exchange it with the veins in these teeny tiny minuscule segments for everything to be perfused, to get the nutrient into the end organ and to get the toxins out. That's the whole point of our circulatory system. How do I deliver nutrients? How do I remove waste? And if we have any compromise to that, whether it's elevated lipids, heart disease, calcification of the arteries, type 2 diabetes, ischemia, all of these things contribute to that lack of perfusion or exchange of nutrients and toxins. Now that end organ is compromised. And when we talk about extremities, the first places that are affected by it, fingers, toes, penis, brain, that's and the end of your nose, right? These are our extremities in our body. That's the furthest things away from your heart, and those are going to be the things that take a hit first. So I see that a lot, and we're talking about the male genitourinary region. I mean, that's an extremity, and we see dysfunction there, and a lot of times it's a result of metabolic imbalance. So there's meds that can help. There's lifestyle changes that can help prevent and slow down progression. So talking about herbs and drugs, when we're talking about spasmolytic or stromal BPH, again, the spasming type of symptoms, the frequency, the urgency, nocturia, oh my God, I have to go to the bathroom. Not everybody has their video up, but when I say, hey, where's the bathroom? If I went into a public space full of 50-plus-year-old men and said, where's the nearest bathroom? I guarantee 80% of them would be like, right there. I know exactly where it is all the time because when I have to go, I got to go and I got to get there in a hurry. That kind of BPH, naturopathic medicine is very effective at. The treatment with conventional medicine, if anybody has it, is tamsulosin, something like that. And what that does is it slows down those synapses, those nerve synapses to relax the smooth muscle. That's the biochemical pathway that goes on. We also use really great herbs that do the same thing. I typically will formulate a tincture for my patient individually where I use those herbs, those spasmolytics they're called, to reduce spasm of the smooth muscle. And then I can formulate individually based on your current medical picture. Do you have metabolic imbalance? Do you have headaches? Do you have GI upset? Is there something else in your body that I can actually add to this formula to make it synergistic for your overall physiology? We really want to avoid diuretics in this type of BPH. A lot of people will say, oh my gosh, I have a hard time peeing, or it's urgent, or it's frequent. Maybe if I just get a diuretic and get it all out, it'll be helpful. It actually contributes to the problem, right? Because we're flushing something down a system that keeps contracting and spasming. So we want to go down on diuretic treatment. When it's epithelial or hormonal, herbs are very safe and much less effective. Saw palmetto, like I mentioned before, is one that we definitely recommend for people with enlarged prostate. And it's only been proven in the research to be effective if your prostate is less than 50 cc. I have no idea how to compare that on the size of a walnut, what 50 cc is. But that definitely is much less effective if it's over 50 cc. Our finasterides are very effective. The 5-alpha reductase inhibitors have actually shown very good at reducing the size of a prostate if it's larger than that. So if anybody comes to me, hey, here's my imaging, here's what I'm doing, I definitely work with that finasteride and naturopathic treatments to help shrink the size of that prostate and improve quality of life. I do want to just give a quick, I have a 9-minute warning here that just popped up on Zoom. So if anybody has burning questions, the other option is you can always type them in. We do have a chat box that if you click on the bottom, you can just click just to me And that way nobody else can see it, and I can answer that question anonymously. Some side effects of the finasteride is they can cause lower libido and erectile dysfunction. It is reversible when you go off the medication. But if somebody comes to me on that medication and BPH and they're saying they have erectile dysfunction, that typically is the first thing that we address is, hey, let's see how we can maybe taper off of this or address that in a more natural way for sure. We talked about diet and lifestyle, exercising, staying on that plant-based food for the most part, and increasing the phytoestrogen foods. And then testing, a lot of people will ask me about PSA and why? What are we doing PSA for? The most effective way that I use PSA, it's imperfect for prostate cancer. BPH also causes an elevated level of PSA. So anytime I see a PSA, I'm more looking for not that isolated PSA, but what has your trend been over time? Are we seeing that increase? At which rate is it increasing? Has prostate cancer been ruled out? Really wanting to make sure that we're taking the conservative approach there. But what I really want, if it's a low PSA, you can kind of rule out BPH and think that your lower urinary tract symptoms are from something else. And the percent-free PSA is something that if you ever do go to a urologist and they're running your PSA over and over and over again, that's something that I would write down and say, hey, can you add on a percent-free as well? It gives us more information of what is the free PSA out there and what is bound. So it can differentiate between the likelihood of prostate cancer versus BPH. Sorry about that. High percent free PSA would argue against cancer, and a low percent free PSA is more consistent with prostate cancer. So those are things that you want to tease out and have a little bit more information going into it. So a question that I did receive here is natural remedies for erectile dysfunction. That's a really loaded question. Pun intended, sorry about that. But so natural remedies for erectile dysfunction, the very first thing that I want to know is why is it there? Is it physiologic? Is it anatomical? Meaning, do we have metabolic imbalance? Are your nerves functioning okay? Have you had any surgeries? Is it anatomic? Do we have BPH? Are you on medications? Is there something else that's blocking your ability to make this? Is there low testosterone? That can also be a cause. The most common reason for erectile dysfunction is cardiovascular disease. And we talked about that. Low perfusion, low blood flow, low nutrient exchange. The other most common reason right up there is actually psychosomatic. Stress, anxiety, worry. When you're running from a bear, it's really hard to have an erection. So we work a lot on that fight or flight response. What is your stress level looking like? A lot of times it's not something that's conscious. So many of my patients are like, but I'm not stressed. I'm retired. I'm doing great. And then we dive in and there's a history maybe of sexual trauma. There's a history of betrayal in a relationship. There's financial struggles. There's purpose struggles. There's, diagnoses in your family or friends or something like that that's coming up that's affecting you in a way that you may not feel it. Hey, I'm not actually stressed in the way that I have felt before. But that part of your body really, really struggles with that because that cortisol level, that hormone from your adrenals directly competes with your body's ability to make your androgens, which are going to support having erections and sexual health. So if I think it's psychosomatic, stress related, I do something that's called a Yohimbe challenge. It's a tincture that's very potent. It's 3 to 5 drops twice a day. And it helps kind of break that biochemical pathway where your stress response could inhibit erections. And if it's useful, then we focus our treatment there. If it's not, then we dive into, and it's a 2-week challenge. If it's not useful, then we really dive into the cardiovascular health, metabolic imbalance, and looking at your hormone balances there. And then we address those similarly. Now, I could do a whole nother lecture on erectile dysfunction. I do recognize that's not why we're here today. So I'm definitely happy to, if that's something that people want to hear about in the future and really dive into, then shoot us a message or an email to the clinic, because we're always open to getting community input on what you want to hear about. But I think that would be a really good follow-up to today's lecture is diving a little bit more into erectile dysfunction and how to help support that. So I hope that answers your question out there for that as far as what today's lecture can can accommodate. What else do we have? Any other questions? I've got about 4 minutes here before they're going to kick me off.
Thank you.
Yeah, of course. A couple other things to try. So call it double voiding. If you're having troubles with dribbling, incomplete emptying, not sure if you're done, hesitancy, different symptoms like that, then I'm a nervous system doc. Anybody who's been a patient of mine knows I'm huge on breath work. Sit down on the toilet. Those of you who have a penis and are tendency to stand up, sit, take a load off, relax, take a few deep breaths. Really understand that, again, when we're running from a bear, when our nervous system is in fight or flight, we sphinct. No one has time to do any of those metabolic processes when we're running. Take a few deep relaxing breaths and do a double void. Wait 10 to 20 seconds and then let the rest of it flow out. There's also clinical evidence, I haven't seen anything in the research, about leaning forward towards the end of it, putting a little bit of gentle pressure on the bladder to help eliminate if you're in a relaxed state. Now, again, if you're tense and you're stressed and you're not going and it's really feeling stuck, then we don't want to force something against a closed tube, of course. But if you're sitting there and you can just gently lean forward, put a little bit of pressure on that bladder, that can help as well. But the very first thing that I tell men is sit down. We got it lucky as ladies. It's the first time and only time I'll ever say I got it lucky. But we get to sit and take a load off every time we go to the bathroom. Sit down. You don't have to aim. Your wife will be happy. Just get it in there and relax. The other thing is really, really avoiding liquids 90 minutes to an hour and a half before bed. We don't want to do large amounts of diuretics, teas, alcohol, or any water unless you're taking your pills within 2 hours of bedtime. Because again, we just don't need to fill up the bladder and then wake up our sleep and interfere with that sleep cycle. The other naturopathic recommendation that I make more often than not is include electrolytes into your hydration status. Get some electrolytes over the counter, wherever the case may be. It helps with cellular hydration and it keeps it so you're not just flushing things through the system. It should really reduce the amount of times you have to use the restroom. I am in within 1 minute, so it's going to cut off. Contact the clinic if you have questions. Shoot me an email. I'm happy to answer more questions at any point in time. I really appreciate you guys being here and participating. And hopefully we'll chat soon.
Thanks again.
Of course. Take care, everybody.